The topic today is still sticking with SPAY, but to consider the complications that can arise and how you recognise them and how you might manage them. So just to really drive home the message that these are young healthy animals, it's a routine elective procedure, but we've got these major blood vessels. But in fact there are other complications that can arise, some of which are a little bit embarrassing. So to try and not so much make sense of them, but to try and group them in your minds, what I've done is decided to think of them in terms of those complications that can arise intraoperatively when you're in there with your knife and fork. Those that are going to arise in the post-operative period, and by that I mean the first 10 days or so following the surgery. And lastly, the delayed ones. These are ones that could crop up immediately or, well, sometimes years later. Now, there is one factor which certainly will complicate or increase the risk of complications, that is obesity. Fortunately, the majority of the animals that you are going to carry out the surgery on are going to be less than a year of age. But it is surprising how often owners turn up and decide after 3 or 4 years that they want the animals spayed. For example, breeders who have decided to take a couple of litters and don't want the animal to have any more litters. And certainly breeders in the UK are restricted in the number of litters that they can put a bitch through from the point of view of puppy farming. So the big complications, the ones that certainly raise hairs in the nape of your neck, are cardiac and respiratory arrest. So this is during surgery, and hemorrhage. It's nothing like hemorrhage to get you worried. Those that you're going to encounter in the first 10 days post-surgery are, as you might imagine, wound breakdown, an incisional hernia, and one that you really have to be alert to, which is called esophagitis. I'll come on to it in a minute. It is a rare condition, but you need to recognise it pretty quickly. And then long term, we can have issues with adhesions, a stump granuloma, which is really just a more severe manifestation of that, and probably the biggest of all of the complications is incontinence. So you're in practice, you're doing the spay, and this is going to happen to you at some stage in your early career, that there's a cardiac arrest. The animal just stops pumping blood around the system. If you're doing the spay on your own with nobody actually really monitoring the anaesthetic, and which can happen, you may not notice that the animal's heart has stopped bleeding because the quality of your surgery is so avascular, you don't notice that there's no bleeding. But should this arise, you need to get pumping. Now, given that you're already in the abdomen, probably the best thing to do is to cut the diaphragm and put your hand into the chest and pump the heart, rather than trying to do extra thoracic massage, pumping the animal up and down as they do in all the medical programs. Can't have a medical program without at least one cardiac arrest per episode. So the question is, why has this happened? Why might this animal have had a cardiac arrest? Number one is an overdose of the induction agent. That's quite possible. Number two, and probably more likely, is that this animal has had a cardiac defect which has been missed. Now you might wonder, how could that be missed? Because this animal will have been vaccinated, this animal will have been checked by you or by someone on admission. Just remember that if these are young puppies, at certainly vaccination, it can often be quite difficult to get the animal to sit still for you to listen really, really carefully to the animal's heart and pick up a murmur, for example. And of course, if it's a very large defect, often the murmur is not that loud, because with a large defect there's not a huge amount of turbulence. The smaller the defect, the more turbulence there often is in these congenital cardiac defects. And it may well be that on admission, because somebody knew that the animal had already been checked at vaccination, the auscultation was cursory. But it will happen to, well, not happen to an animal that you're managing, that it'll just have a cardiac arrest. That's quite difficult to explain away to the owner, other than normally when animals are being admitted there is always a warning about anaesthetic risks. Another one, which is not quite so critical, is respiratory arrest. The animal stops breathing. Again, if you are on your own, or if the person that is monitoring the anaesthetic's doing other things at the same time, you might not notice that the drapes are not moving up or down. So what should you do? Number one, check that there's actually gas going through, that for example there's oxygen coming from the cylinders. If it's a pipeline system, has somebody remembered to actually switch the oxygen on when they've moved the animal from a prep area into the theatre? Check that the endotracheal tube is in place and hasn't fallen out. That's much more likely to arise in small dogs and cats, that in moving the animal, the weight of all the other anaesthetic kit pulls the endotracheal tube out of the animal's trachea. If there's any of these issues, you need to re-intubate, get the gas going, and IPPV, start getting some oxygen into the animal. Again, why might it have happened? Induction overdose, inhalational overdose because not enough oxygen was going through, so the actual percentage that you thought you were delivering, you haven't been delivering. Lack of attention typically is why the animals will have a respiratory arrest. So it is really important that you not only pay attention to what you're doing, but just keep an eye on the animal as a whole, that it is breathing. And I know that sounds difficult, but you need to do that. So the one that really causes you issues at the time of the surgery is hemorrhage, and it's certainly in your early days the one that you'll be thinking about late at night. Is this animal going to bleed out? Should I have done something more at the time? There was blood there. So yes, you should be worried about hemorrhage, but I have found that most often the hemorrhage that you encounter within the abdomen isn't actually coming from the abdomen. Well, it's not coming from the ovarian artery or vein or the uterine artery or vein. It's actually coming from either the subcutaneous fat, as you can see in that image there. We're closing up and there is very definitely an ooze. And sometimes just at the back of the wound there may be a little vessel in either in the skin or on the subcutaneous tissue that just oozes away. If you spot that as you go in, swab it, clamp it, and leave the clamp on for a couple of minutes. The other location where you can get, let's call it, for want of a better word, false hemorrhage, i.e. not hemorrhage that is of a major concern, is the falciform fat. Now that may be as you go through the linea alba, or because you decide to carry out some liposuction for the owner free and you take away the falciform fat, you may get a little hemorrhage there. But if you look carefully, you can usually see the hemorrhage dripping into the wound. The time that you're most likely to check for hemorrhage is that after you've lowered the stump into the wound and drawn it back out again, you don't see any hemorrhage, that's fine. But you just have an idea of how much fluid is in the abdomen. You repeat the other ovary, you again check the stump, just get a vague quick look. The amount of fluid in there is acceptable, and the same when you have sectioned the uterine artery and vein or ligated them. But before you close up, you should always have a good look in the abdomen to see how much fluid is there. There will always be a little bit of blood in the abdomen, but what you shouldn't see are the intestines swimming in blood. If you see the intestines swimming in blood, you know that you have a major issue there that you need to check on. So first of all, rule out that it's not subcutaneous hemorrhage or falciform fat that is actually responsible for your concern. However, if it is genuinely hemorrhage as a result of the actual spay procedure, then in the dog it's going to be the ovarian artery. Which one do you think is most likely to bleed? If you remember back to your basic abdominal anatomy, the right kidney is further cranial than the left. That means the right ovary is further cranial than the left, which means that when you exteriorize it, there's going to be more tension on the right side than there will be on the left. So that's the one you go after first to check on. In the cat, it's going to be the uterine artery if there's going to be hemorrhage. I have to admit that I have never seen that as a problem. Just never seen it. I've seen a few ovarian artery leaks. What you don't want to do is simply pull all the intestines out onto out of the abdomen. That's not really the best way to go about it. First thing you do is don't panic. Secondly, it's probably a good idea to ask somebody else to come and help you, particularly if they're experienced. Remember, they didn't cause the bleed, so they can feel more comfortable and professional, whilst you're thinking, oh. So you definitely need assistance if you're doing this, if this has happened to you on your own. And there are two manoeuvres that you can make that make life a lot easier, and they're called the duodenal manoeuvre and the colonic manoeuvre. So what you want to do is to identify the duodenum. It's wider than the rest of the small bowel, and the pancreas is there. And with two hands, you get the assistant to lift the duodenum, exteriorise it, and draw it across to the left-hand side. And in doing that, the mesoduodenum acts like a curtain and keeps all the intestines and other organs and moves them across to the left, so that you've got the body wall, the mesoduodenum, and you can look straight down to where the right kidney is, because that's where the problem will be. So you look at the caudal pole, and what you will typically see there is spurt, spurt, spurt. And sitting beside spurt, spurt, spurt is your ligature, which has slipped off, generally speaking. Sometimes the ligature's still there and it's bleeding because the ligature has not been put on tightly enough. You reclamp and you religate, and that'll stop the hemorrhage. So that makes you feel very comfortable. Aha, I've solved that problem. But if you've had a problem on the right, you should always check on the left-hand side, because the chances are if you made a dog's dinner off the right, you've made a dog's dinner off the left, and the ligature probably is not that tight. So in that situation, you put the duodenum back into the abdomen, get a hold of the colon, and draw it to the right-hand side, which will allow you to look at the left kidney. And preferably just leave the blood in the abdomen. Now I know you're going to maybe have to swab to see where the bleeder actually is, but if at all possible, just leave the blood in the abdomen and it will be resorbed. It's going to happen to you. It's extremely unlikely that it will happen to you in your first 5 or 10 spays. It's after that you'll have one of these incidents. And the reason for that is after about 5 to 10 spays, you begin to think you're a bit of a Jack the Lad, and you make your wounds smaller, you try and be faster, and that's when problems arise.